Hello, and welcome to the Reproductive Health Program Enrollment Form Training for C-Care-only clinics. My name is Allison Babich, and I'm the Reproductive Health Provider Liaison. This video is meant to help clinic staff at C-Care-only clinics navigate the RH Program Enrollment Form. To give staff a full understanding of how we use the information provided on the enrollment form, I'll start by going over all of our funding streams and describe how they affect services, eligibility, and coverage. Then I'll focus on C-Care and go over each section of the enrollment form, including the enrollment questions and the demographics questions, and the staff page. And I'll finish by showing the client enrollment webpage where you can find more resources. Before we get started, this table lists a few documents that might be helpful to have in front of you as you watch this video. They can all be found on our client enrollment webpage, which is healthoregon.org/RH client enrollment. Feel free to pause the video at this point and get these documents before moving forward. I also want to point out that throughout these slides you will see orange links. Unfortunately, they aren't clickable in the video, but they are in the slides themselves. And you can find the slides on our training page, which is healthoregon.org/RH trainings. Okay, so let's get started. As you'll remember from the orientation, we get funding from 3 different sources: C-Care, REA, and Reproductive Health State General Funds. Each cover slightly different services and have different eligibility requirements. C-Care covers services related to contraception because its purpose is to prevent unintended pregnancies. To be eligible, clients must either be able to get pregnant or get someone else pregnant, be at or below 250% of the federal poverty level, be an Oregon resident, and either have U.S. citizenship or eligible immigration status. C-Care also requires that we verify clients' incomes and their citizenship or immigration status. REA covers a broad range of reproductive health services and requires that the client be able to get pregnant, so they must be female-bodied. They must also be at or below 250% of the federal poverty level, be an Oregon resident, and have another immigration status. Unlike C-Care, REA does not require verification of any of the client's information. Now, I recognize that the terms eligible immigration status and another immigration status mean nothing to most people, but I will explain them later in the video. Finally, the Reproductive Health State General Funds cover family planning services and require that the client either be able to get pregnant or get someone else pregnant and be at 250% of the federal poverty level. There are no requirements about residency or citizenship or immigration status, nor does it require verification. Now, while the state general funds have the fewest eligibility requirements, it is also, unfortunately, our smallest pot of money. For many of our clinics, the 3 funding streams are braided so that we can cover as many services for as many clients as possible. We currently call this braided funding the full RH program. However, since your clinics only receive C-Care, we can only cover clients who meet the C-Care eligibility requirements and receive services related to contraception. To reduce barriers for clients, we decided to use the same enrollment form at all of our clinics. This means that if a client is determined eligible at a C-Care only clinic, they can also get free services at a full RH program clinic without having to complete a whole new enrollment form. However, we also wanted clients to understand what they can get at C-Care only clinics, so we developed a special cover page for the enrollment form. It describes the C-Care eligibility requirements, what services are covered, and has space at the bottom where you can add your local full RH program clinics. The cover page is on our client enrollment webpage in the CCare corner and is available in all the same languages as the enrollment form. And you can find your local RH program clinics by going to our Find a Clinic webpage. You can search by county or name or address or whatever, and on the right it says what type of clinic it is. Okay, it's enrollment form time. The enrollment form is available on our client enrollment webpage in English, Spanish, Russian, Vietnamese, Simplified Chinese, and Korean. And it essentially has three sections: the eligibility section, the demographics section, and the staff page. Let's start by going over the eligibility section, which takes up the first 3 pages. The questions in this section do 2 things. They either determine a client's eligibility for RH program coverage and/or they determine what funding stream we should use for the client's services. The first thing we ask for is the client's legal name. This is their name as it appears on documents like their driver's license. The reason we need the client's legal name is because the client's name is one piece of information we use to verify their income and citizenship or immigration status for CCare. For example, if you have a client whose legal name is Abigail, but she writes Abby, we won't be able to verify her information. Then we ask for the client's address. This is where the client would like to get mail. If they are houseless or are worried about confidentiality, they can put the clinic's address. Next is date of birth. This is to make sure that the client is within the age range of being able to get pregnant or get someone else pregnant. We also use it to verify client's information for CCare. Please ask the client to use the U.S. convention of month, day, and year. We then give clients the option of listing their age and gender identity. These 2 fields are not required, nor are they in the eligibility database. We added the field for age because, as you'll see later, a person's immigration status may change depending on their age. And we added the gender identity field because we wanted to allow clients to be able to self-identify. Next, we ask for the client's sex assigned at birth. This is the client's sex as was marked on their birth certificate. We need this to determine the correct funding source for the client's services, because if you remember, REA can only be used if the client is female-bodied. Then we come to questions 4 and 5, which ask about the client's reproductive capacity. All of our funding streams require that the client either be able to get pregnant or get someone else pregnant. So if a client is postmenopausal or has been sterilized, they are not eligible for the RH program. To be honest, we struggled with how to word these questions in a way that was both medically accurate and low literacy. Since we've rolled out the enrollment form, we've received suggestions for more understandable wording and will definitely incorporate them in our next version of the enrollment form. But for now, just be sure to review these questions with the client to ensure that they answered them correctly, because if they checked yes to either, they are not eligible for the RH program. Question 4 asks if the client is postmenopausal. A client should check yes if they have stopped having a period due to menopause. If they are 45 or older and still getting their period, or if they stopped getting it because of contraceptives or other medical reasons, they should check no. And they should check not applicable if they are male-bodied or younger than 45. Question 5 asks if the client has been sterilized for more than 6 months. They should only check yes if they've had a medical procedure that prevents them from getting pregnant or getting someone else pregnant. Next, we come to questions 6 and 7. These questions ask about client citizenship or immigration status and social security number. You'll notice at the top we have a statement that says no matter how the client answers, they can still get free services. This is only applicable at full RH program clinics. Because CCare is a Medicaid waiver program, clients must either have U.S. citizenship or eligible immigration status, and they must provide the Social Security number within 90 days of enrolling. If a client has another immigration status and or don't have a Social Security number or cannot provide it within 90 days, you should refer them to your local full RH program clinic. So let's talk about what these terms mean. A person is a U.S. citizen if they were born in the U.S., Puerto Rico, Guam, or the Virgin Islands. Now, I don't know about you, but I sure don't remember my high school geography lessons, and I wanted to know where Guam and the Virgin Islands are, so I looked them up. And as you can see, Guam is over by Indonesia, and the U.S. Virgin Islands are near Puerto Rico. A person is also a U.S. citizen if they've been naturalized or gained citizenship through the Child Citizenship Act of 2000, or if they were born outside the U.S. to a U.S. citizen. A person is a U.S. national if they were born in the American Samoa or Commonwealth of Northern Mariana Islands, which are circled in blue. Then we come to eligible immigration status, which means an immigration status that is eligible for Medicaid. This includes refugees and asylees, and folks with work or student visas if they are younger than 19, and folks with lawful permanent resident status if they are younger than 19 or 19 or older and have had LPR status for 5 or more years. Then another immigration status means an immigration status that is not eligible for Medicaid. This includes folks with DACA, folks who are undocumented, or folks who have work or student visas if they are 19 or older, and folks with lawful permanent resident status if they are 19 or older and have had LPR status for less than 5 years. As you can see, determining whether a client has an immigration status that puts them in the eligible immigration status category or the another immigration status category is not cut and dry. It is actually super confusing. So to help both clients and clinic staff, we created this citizen and immigration status chart. It is available on our client enrollment webpage in all the same languages as the enrollment form, and we highly, highly encourage staff to use this chart to ensure that clients have answered the question accurately. And if after looking at the chart, a client still doesn't know how to answer, we have guidance on how to help the client. This is also available on our client enrollment webpage. Next, we ask for the client's Social Security number. This is another piece of information we use to verify a client's income and U.S. citizenship. If a client does not know their Social Security number, we will still reimburse for their services for 90 days. After that, if they still cannot provide it, you should refer them to your local full RH program clinic. At the top of page 2, we ask whether the client has OHP. This is yet another question that can determine a client's eligibility for CCare. If you remember, a client does not qualify if they have OHP. And if a client checks yes, but just for emergencies or pregnancy, they do not qualify for CCare, but may still qualify for RH program coverage because CALM and CALM Plus are not full OHP. So you should refer them to your local full RH program clinic. Note that if a client checked that they have CALM or CALM Plus, they should also have checked that they have another immigration status, as CALM and CALM Plus are only available to people with another immigration status. If the client checked I don't know, you should look them up in MMIS because claims submitted for clients with OHP will be rejected. Questions 9 and 10 ask if a client has any other health insurance and whether they need confidentiality for their reproductive health services. These questions are asked for billing purposes. Clients can still qualify for RH program coverage if they have private insurance or Medicare. The reason we ask is because we must be the payer of last resort. However, if a client indicates that they need confidentiality, do not bill their insurance, just bill us. The next two questions ask for the client's household size and income. This is to determine the client's income in relation to the federal poverty level. Let's start with household size. Just like OHP, we measure household size based on tax filings. Now, we know that many clients do not know this information. They may not even know what a tax filing is. The first thing to do is to assure them that this information is self-declared, meaning we don't look it up. Then just try to help them figure it out. To help with this question, we created this flowchart, which is available on our client enrollment webpage. It starts by asking if the client filed taxes last year. If they did, they need to include anyone they claimed on their taxes, like a spouse or children. For example, say a client has 2 children, both of whom they claimed on their taxes. Their household size would be 3, themselves and their 2 children. If the client did not file taxes last year, ask if anyone else could have claimed them, like a parent. If the answer is no, their household size is 1. If the answer is yes, they must include themselves, the person who filed the taxes, and anyone else they think would have been on the taxes, like siblings or another parent. So taking one of the children from the first example, their household size would also be 3, themselves, their parent, and their sibling. We know this is kind of convoluted, so clients should really just put their best guess. Like I said before, we do not verify this information, and if the client really doesn't know, they can just put 1. Then we move on to income. In this section, we only want the client's income, not their parents, not their spouses, just the client's. Our enrollment form guide lists what counts as income and can be found on our client enrollment webpage. The final question in the eligibility section of the enrollment form is about voter registration. Federal law requires that Medicaid recipients be offered the chance to register to vote. This means all clinics should keep voter registration cards available for clients who check yes to this question. If a client checks yes, you should give them a voter registration card and offer to help them fill it out and mail it, though they can just take it and do it themselves. If a client checks no, no other action is required. And the option NA is for clients who are either already registered or are not eligible to register. And the last part of the eligibility section is the third page, where we have the Social Security number statement and the client signature. The Social Security statement tells clients why we ask for their Social Security number, and the client must sign and date the enrollment form. Even if a client completed the rest of the enrollment form, if they haven't signed and correctly dated the form, we cannot pay for their services, nor can you bill the client. So it's super important to check this field before they leave the clinic. And that covers the eligibility questions. Next are the demographic questions. None of these questions have anything to do with eligibility in the RH program. Their purpose is to help us reduce health disparities and ensure that folks receiving services are treated equitably. Clients should answer these questions however they want. Almost all the questions have a decline to answer option if they're uncomfortable answering, and they are also the last questions the clients must answer. Now that the client is done with the enrollment form, they will hand it in, at which point it is super important that you check it. There are some questions that can determine a client ineligible outright, and others that are just confusing. You should also check for completeness. If an enrollment form isn't complete, the client can't be enrolled for RH program coverage. To help with this, we created an enrollment form quick check guide, which, surprise, surprise, can be found on our client enrollment webpage. And it goes over the most important questions to review. If a client checked yes to question 4 or 5, they are not eligible for the RH program. Clients must either be able to get pregnant or get someone else pregnant. If a client checked yes to question 8, they are not eligible for RH program coverage. If they checked yes, but just for emergencies or pregnancy, they are eligible for RH program coverage, but should be referred to a full RH program clinic because we cannot reimburse C-Care only clinics for their services. Questions 6 and 11 and 12 are the most complicated, and you should check with the client to ensure that they answer correctly. Finally, if the client has not signed and correctly dated the enrollment form, the services they received that day will not be reimbursed and you won't be able to bill the client. The last page in the enrollment form is just for staff. Let's go through the top portion first. First, we need the agency and clinic's AILRS numbers, and then the date that you are reviewing the form. Next, we ask for the name of the staff person who is going over the form with the client. This is in case there are questions about the form during an audit. Then we ask for the client's RH program number, which is the number assigned to the client after their information is saved in the eligibility database. Next, we ask for the client's FPL. To be eligible for the RH program coverage, their individual income must be 250% or below the federal poverty level. If they are above that, you must still provide them services, but you may charge them based on your normal clinic practice. Next are checkboxes to ensure that staff are following our customer care requirements. Staff must offer all clients the OHA Notice of Privacy Practices. Clients do not need to take them, but they must be given the opportunity. The Notice of Privacy Practices are available in several languages, and we have links to them on our client enrollment webpage. Staff should also explain what types of services are covered by the RH program and discuss payment options for any services they may get that are not covered. Staff should also provide the client information on where they can get primary care if needed, and where they can enroll in health insurance if needed. Okay, now let's go over the section staff must complete for clients with U.S. citizenship or eligible immigration status. The first question is to ensure that staff offer clients voter registration cards to those who answered yes on the voter registration question. The rest of this section is to track documents collected for verification of citizenship or immigration status and identity as is required under C-Care. There are several documents a client can have that prove their citizenship or immigration status and their identity. And we have a resource on our client enrollment webpage that lists many of these documents. The first section is for clients with U.S. citizenship or national status. There are 3 options for clients with U.S. citizenship or national status. The first is to bring in some kind of document like a passport or birth certificate. If they do bring something in, with the exception of birth certificates, make a copy and place it in the client's record. If the client brings in their birth certificate, do not make a copy. Instead, enter its state file number in the eligibility database. The state file number is usually around 13 digits long and is sometimes called the birth certificate number. Unfortunately, its location on each birth certificate varies from state to state and sometimes year to year. I know there isn't a designated place to write this number on the enrollment form. We do plan on adding a place in our next iteration, but in the meantime, you can just write it on this page of the enrollment form if you like. The second option is to request an electronic match. The electronic match process uses clients' names, social security number, and date of birth, and it has a 92% success rate. This is especially helpful for clients who do not have access to their citizenship documentation. For more information on the electronic match, see our client verification FAQs on our client enrollment webpage. The third box is for clients who are re-enrolling and have already had their citizenship or national status verified. You can find out if this is the case for a client by looking for them in the eligibility database. The next section is for clients with eligible immigration status. Verifying immigration status is a much more complicated process than verifying citizenship or national status. For this reason, we require specific information from each immigration document, or better yet, a copy of the document. There are 3 options for clients with eligible immigration status. The first is to bring in their immigration documentation. This is the most ideal. When this happens, mark this box and then make a copy of each side of the document. It is super important that you make sure that the copy is legible. Then send us a copy of that document. We have instructions on how to send confidential information via fax, secure email, or regular mail on our client enrollment webpage. If you send a copy using regular mail, be sure to make 2 copies of each side of the document, one to keep in the client's record and one to send to us. The second box is for clients who did not bring in their documentation but who call with the information later. When this happens, mark the second box and write the information in the spaces provided. Unfortunately, the information we need is different depending on the immigration document because nothing about immigration is simple. The resource I mentioned a few slides ago that lists the types of document that prove citizenship, immigration, and identity lists what information we need from the different immigration documents. And of course, if you have any questions, don't hesitate to contact us. The third box is for clients who are re-enrolling and have already had their immigration status verified. And you can find out if this is the case for a client by looking for them in the eligibility database. The final section is for proof of identity. Many documents that prove citizenship or eligible immigration status also prove identity, but not all. For example, birth certificates do not prove identity. When this is the case, be sure to ask the client for a driver's license or school ID. Make a copy of the ID and place it in the client's record. So what if a client doesn't bring in any documentation? Nothing to prove citizenship or immigration status or identity. Don't panic. CCARE will pay for 90 days, and if the client is a U.S. citizen, state staff will work to verify their citizenship electronically. But you should always ask the client to bring in their documentation when they can. As we wrap up, I want to suggest a few workflow processes to take under consideration. Where will you keep the enrollment forms? Will you keep the paper forms? Will you scan them and put them in the client's EHR record? If you scan them, remember to scan both sides of the paper. When will you enter the enrollment forms into the eligibility database? When the client hands theirs in, once a week. And finally, I'd like to encourage you to give enough time for clients to complete the enrollment form and staff to review it for accuracy. The form is not short, and it can take time to get through all the pieces. And remember our quick check guide. Finally, I want to leave you with where you can find our resources and tools for client enrollment. The web page is health oregon.org/RH client enrollment, and that's one word. And that concludes this video. Thank you for listening, and if you have any questions, don't hesitate to reach out. Have a great day.